I'm Dr. Luke Bynum. It's important that you know I have a doctorate. It's important that you know I went to school for 7 years, and then I spent 2 more years obtaining a specialty board certification in orthopedic physical therapy. But even with all those years of training, in Mississippi, I can't see a patient without them first visiting a physician, nurse practitioner, physician assistant, dentist, podiatrist, or a chiropractor, and obtaining a physical therapy prescription. Mississippi, you need to do better. You need to do better because there are only 2 states left in the United States that prevent a physical therapist from treating patients without a prescription: Alabama and Mississippi. Consider this. In Mississippi, if you have back pain, you can go get a massage to address your pain. Your massage therapist has a minimum of 1 year of training. You can pay that massage therapist literally until you run out of money without ever seeing someone for a prescription. But you can't see a doctor of physical therapy to address your back pain without a prescription. In Mississippi, if you want to learn some exercises to strengthen your back, you can go to the gym and hire a personal trainer who potentially obtained their personal training certificate online, which doesn't even require a college degree. You can pay that personal trainer also until you run out of money without ever seeing someone for a prescription, but you can't see a doctor of physical therapy to learn strengthening exercises without a prescription. Education isn't the issue. A nurse practitioner attends school for 5 to 6 years and typically has an entry-level master's degree. A physician assistant attends school for 6 years and has an entry-level master's degree. A physical therapist attends school for 7 years and has a doctorate degree. But in Mississippi, a physical therapist can't treat a patient unless they have a prescription from providers such as nurse practitioners and physician assistants. I'm not saying that physical therapists are smarter than nurse practitioners and physician assistants because our program lengths were longer, but as a physical therapist, you are the expert in neuromusculoskeletal anatomy and pathology. You are an expert in recognizing when a patient needs to be evaluated by the next level of care, and you make those referrals regularly. Mississippi, you need to do better. Safety isn't the issue. Many years ago, restricting a physical therapist's ability to treat without the patient first seeing a physician was rooted in the guise of patient safety. That argument has long been defeated as evidenced by 48 U.S. states with direct access for physical therapists. Or if patient safety really was the concern, how can Mississippi residents see a massage therapist to address their back pain or a personal trainer to address their weakness without first obtaining a prescription? Considering a Mississippi patient has complete access to visit a massage therapist or a personal trainer to improve their back pain, and if access to healthcare is truly important for Mississippians, it's difficult to justify a doctor of physical therapy not being able to treat a patient without the patient first receiving a prescription. There have been many direct access bills for physical therapists to pass through the legislature over the years. They usually die in committee. I'd like to think the only reason this could occur is because there are other more important pressing issues to be addressed by the Mississippi legislature. However, Mississippi is one of 2 states left without direct access for physical therapists. It's time to fix this discrepancy. Mississippi can do better. We should not be the last state in the U.S. without direct access to physical therapy services. Mississippi, you need to do better. Don't allow another year to pass without removing the referral requirement from the Physical Therapy Practice Act. Don't allow Mississippi to become the last state in the United States without direct access. Do better, Mississippi. Mississippi physical therapists, you must come together. You need to tell your friends. You need to tell your family members. You need to tell your legislature. Share this video with all of them. If what I just said wasn't enough, then consider this. In Mississippi, a patient does not need a prescription to see an occupational therapist, but they need a prescription to see a physical therapist. If that doesn't stir you up, I don't know what will.